Improved your health care without you even knowing it. She spends her days pretending to be a patient so medical students can make their mistakes on her instead of on you. Donna works as a standardized patient, aka a medical actor. She's also part of this year's Cincy Fringe Festival, sharing her stories of young medical professionals. Oh boy, and some of the mistakes that they've made.
Oh, it is amazing.
Yeah. Well, first of all, welcome to Cincinnati. You're from Portland.
There.
I know you've been part of the Fringe before. I love the Fringe. It's just such an amazing community of people.
It is absolutely loving. I mean, the support behind the artists here in this town is just delightful to see.
We are pretty lucky in this town.
Yeah.
So, how did you get started being a medical actor?
Well, it was quite by circumstance. I met the right person. There's a whole pool of actors in Portland that did this, and I got involved in it because of various aspects of my health history and my ability to just talk without stopping. I was very adept at it, and I've been doing it now for almost 10 years.
I was telling you in the commercial break, my only real exposure to this was in the Seinfeld episode when Kramer and Mickey were medical actors in New York City.
Yes.
So I knew that this existed, but I didn't know it was like an actual profession. I mean, is this what you do kind of full time?
It is one of my primary jobs.
Wow.
Of course, the nature of gig economy, you do multiple jobs, but it is one of the primary forms. And it is an art form and a learning tool that is expanding more and more.
Well, I bet as the technology grows, there's different things that they're trying out on you, I guess.
And there's part of that, part of it is being just the warm body to learn things on, and sometimes they learn how to do everything on me. But there's also the primary form of it is learning communication, because we're realizing in healthcare that people not feeling listened to, people getting misdiagnosed is primarily due to just poor communication. So that's the greatest skill that we as the simulated patients provide, is helping healthcare professionals learn how to truly communicate and truly listen to their patients.
So are you, I don't want to give anything away in the show, but are there any funny stories that you're able to tell us of some things that have happened to you that you thought, that's wrong, doctor?
Well, there's a lot of them that were in the show. One of the, I mean, it could be little things like, I remember I was doing an exam and a girl in my room, and she was very country. She was from South Carolina, and you could just tell that she had grown up in the country. And she was trying to remember the word for drape because she had to pull back a drape, and she said, okay, I'm gonna remove the tarp. And it's, you know, it could be little things like that, like not being able to find the word or being nervous and touching a person really awkwardly. Sometimes the situations get very awkward, and those are some of the highlights.
If they're personal, like you said, sometimes they're doing their very first pelvic exam on you, the first one they've ever done ever?
Yes. Okay. There's a lot of really intense eye contact and very broad smiling.
I can see right there why she is the perfect person to do this job. Now, they don't know that you're a medical actor, right?
So they do.
Oh, they do?
Oh, they do. Because one of the purposes of it is to provide a safe simulation where, as I say, where they can totally screw up without having to worry about a malpractice suit, because it is in failure that we learn.
Right.
So they know it's a simulation, but it also gives them an opportunity to practice those skills of committing to a situation, because everybody's been in a situation where somebody has said something entirely out of left field, and you've got to maintain that game face. So it provides skills on multiple levels.
What made you decide, I'm putting this in a show? Just all the amount of stories that you have?
Well, there's all the stories. We all share things that, not too much information, but we're like, you won't believe what this person said today. But also, I've met so many folks that say, I didn't know this job actually existed. And those elements together, I think it's important for folks to know that we're actually making advances in the personal communications in healthcare.
I love that. You're doing amazing work.
I like doing it.
And I'm sure the show is amazing as well. So if you would like to see it, there are a couple chances coming up still. Diagnose This at the Cincy Fringe is tomorrow. It starts at 8:30 at the Art Academy of Cincinnati on Jackson Street. And there are also performances on Wednesday and Friday, right?
Yes.
So it's 3 more opportunities to see her. And we'll have all the details at local12.com. You can click on the Get It Now links for more details. Thank you so much for joining us, and good luck with the show. It sounds wonderful.
Very much.
Tara, over to you.